Hey there, Gen Psych. This is the very last chapter in a very large course. Congratulations on making it this far. I'm very proud of you. I've actually made this chapter relatively short, and so I hope this will be a good way to wrap a bow on a really interesting course. This chapter is on psychological treatments and therapies. In other words, what are we going to do about all those psychological disorders that we discussed in the last chapter? So we have 3 sections, 3 videos. One will be sort of introducing the ideas of psychotherapy, a little bit of a look at history and does it work. Then we'll take a look at 4 different psychotherapy approaches: psychodynamic, humanistic, behavioral, and cognitive, and then finally we'll look at behavioral therapy or biological therapies. So let's start with a brief introduction. We're going to take a look at a very, very primitive past, and then we're going to ask ourselves, does therapy work? So when I say there was a primitive past, I mean it. It was barbaric, to say the least. So in the Stone Age, people would engage in what's called trephination, and holes would be drilled in the skull in order to create an exit route for evil spirits. So that's what they're doing here. This poor guy has a mental illness, and they're taking stones and they're cracking his skull open with the idea that the illness is caused by evil spirits, and if they could just release the spirit, then things will be better. We're going to fast forward, way forward to the 16th century, where we had asylums. These were special places created by religious groups to house and treat people with psychological disorders. So this is a 16th century insane asylum. Very, very large. You can imagine they have a lot of people in there. By the late 1700s, Philippe Pinel began reformation of the system. He advocated for what he called moral treatment, kindness, and respect. By the mid to late 1800s, Dorothea Dix championed mental hygiene movement in the United States, and by the early 1900s, psychiatrists began to view mental health as a continuum, and they began to actually classify disorders. This is the beginning of the DSM. Of the process toward the DSM. The first DSM was created in 1952. So here we have some 16th century insane asylums. We have Neanderthal trephination. This is a restraint that was used in the 1800s in an insane asylum. You can see that the person is on a chair. They have straps that are holding feet, the body and the hands in place. And then this is a box that goes around the head. The idea here is that if we can reduce the amount of stimulation that the person experiences, that they will be better off. And so this was obviously not helpful for people. This is Dorothea Dix. She was an American school teacher who led the mental hygiene movement in the United States. She was really trying to improve the treatment of people living in mental institutions. Her work began in the mid-1800s at a time when people in some mental hospitals were still chained up, beaten, and locked in cages. So a good deal of gratitude to Dorothea Dix. In the mid-1950s, and about the 1950s or so, the middle of the century, there was a push for deinstitutionalization. This was a mass movement of patients with psych disorders being moved out of mental institutions in the mid to late 1950s. The idea here was good-hearted. The idea was that people should not be in those insane asylums, should not be strapped to chairs, and that it would be better for them to be reintegrated into the community. If you've ever been in a hospital, you can certainly understand that impulse. I've been hospitalized a couple of times. I had an appendectomy, and I remember thinking, if I could get out of here, I would feel so much better because it was just kind of an awful place to be. Now, in addition to the compassion that people were having, there was also a new development that was also spurring this reform, and that was the development of Thorazine. This was the first effective antipsychotic. So before that, you really didn't have any medications to treat people with psychosis, and psychosis is not something that you can do talk therapy for. Nobody who has who experiences talk therapy is going to get better. So talk therapy is not effective for psychosis, but drugs can be somewhat effective for psychosis, and Thorazine was the first one. So if now you have a drug that can help people with psychosis or schizophrenia, maybe you can medicate them, and maybe they would be able to be reintegrated into the community. And that seemed like a good goal. In spite of the deinstitutionalization movement, psychiatric hospitals and institutions continue to play an important role in the treatment of psych disorders. One of the things that happened with deinstitutionalization is that when you push everybody out of institutions, sometimes they're not able to integrate into the community. So at the present moment, we have a large homeless population in the United States, particularly in California, Austin, Texas. It's coming to the mid-cities area. I've been observing that, and these are often people who may be addicted to drugs or mentally ill, and some people want to argue that it's better to let them live freely, and other people argue that this is not living freely, that they need treatment. So this is the push-pull of deinstitutionalization. It sounds rosy to put people back in the community, but one of the effects of that can be large homeless encampments where people are experiencing severe drug addiction. I shared with you about the drug in the consciousness chapter that rots your skin and your flesh. So that was called trank dope, and there are people who are living out in the streets because of this, and some people say that's their choice and they should be allowed to do that, and other people say this isn't compassionate and they would be better off in an institution. So I'll leave that for you to think about and ponder. I don't have the answer. So what we see here is a decline since the 1950s. The rate of institutionalization has rapidly declined, but we may be moving toward a time, we'll see in the next 20 years or so, where institutionalization becomes more common. So what are the approaches to treating psych disorders? You can take a psychological approach, or you can take a biological approach, or you can do both. So the psychological approach is talk therapy. This is conducted by people who are clinical psychologists, or counselors, or social workers. These are licensed and certified practitioners. Not just anybody can say, hey, I'm a counselor. You have to go through a tremendous amount of training. At a minimum, you're talking about a master's degree plus several, quite a bit of time, many hundreds of hours of practice. They're trained in diagnosing, administering assessments, and conducting therapy, and these therapies can be given alone or with medication. The biological approach is medication, or potentially surgery as well. These are administered by medical doctors, such as psychiatrists. So a psychologist or a counselor or a social worker cannot prescribe medication, but they can work with a medical doctor or a psychiatrist. And a psychiatrist is a medical doctor who has also had 4 years of psychiatric residency to prescribe medication. So psychiatrists are trained in psychotherapy as well as medical therapy. So here's the crux of the question. Does psychotherapy work, and is one approach better than another? There are a lot of different types of therapy. Cognitive behavioral therapy, dialectical behavioral therapy, interpersonal therapy, Freudian therapy, family therapy, couples therapy. There's just many, art therapy, music therapy, many different types of therapy. So our question really is one, does it work, and is one better than the other? And the answer is yes. 13 to 14 sessions of psychotherapy are better than placebo or nothing at all. And the progress tends to be maintained for 2 to 3 years. And is this better than medication, or is this better than nothing? Absolutely. So this is showing participants who received psychotherapy, and this is showing participants who didn't receive psychotherapy. So you can see that both of them do get better over time. It's not going to be true of all disorders. Something like schizophrenia probably will not get better without anything at all. But schizophrenia will not particularly be affected by psychotherapy either. It's going to need medication. So you can see, though, that although both get better, the people who are receiving therapy get better much faster. And they get better, their level of well-being is overall improved. So definitely worth it to seek out some therapy. On that note, I want to let you know that all TCC students receive 6 free counseling sessions with a licensed therapist, a licensed counselor. So if you have any issues that you're dealing with, you can go and get that. That's already paid for in your tuition. And if you need more than that, then they'll refer you out. So psychotherapy is significantly more effective than no treatment. And on average, the person who completes psychotherapy is better off than about 80% of the people in an untreated control group. And the gains, here's the main thing, gains that people make as a result of psychotherapy tend to endure long after the therapy has ended. So you learn skills in therapy that you can take with you that will give you a long-lasting effect. Here's another interesting little factoid. PET scans show changes equivalent to drug therapies. So we can give person A a drug, or we can give person B psychotherapy. Both of their brains may change in ways that are identical. So that's something to consider. Probably better to do talk therapy than to have a medication, especially if one lasts longer than another. Is one therapy better than others? Well, that really is going to depend on the diagnosis. For example, medication is much better than psychotherapy for disorders like bipolar or schizophrenia, but psychotherapy is much better for something like phobia or anxiety. Evidence-based practice means that decisions about treatment are based on 1, the best available research, 2, the therapist's clinical judgment, and 3, client characteristics, culture, and preferences. So the research, for example, on borderline personality disorder is very clear that dialectical behavioral therapy is the best one. That's what the research says. Now, the therapist might decide that this person might be better with interpersonal therapy, but that would be a judgment call. And then you have to consider the characteristics, culture, and preferences. If this is a person who's deeply embedded in their family, or if there are family issues going on, you may need to do something like DBT for the individual and then family therapy for the family as a whole. All right, that is our introduction to treatments, and so I'll see you in the next video. We're going to talk about psychodynamic, humanistic, behavioral, and cognitive therapies.